Thank you, Allison. Thank you, everyone, for attending. We truly appreciate it. And I'd like to talk a little bit about, actually, I'm going to start out with introducing myself a little bit more. Before I was working with Transworld, and I have been here for 7 years, I'm district manager and technology partner lead. We work national accounts, as well as I am right here. You mentioned most people from the Northeast. That's actually where I'm located. I'm right in the New York metro area. Prior to working with Transworld, I have an accounting background. I have experience as an office manager for a medical practice where I literally did everything from, I'm sure you can all recognize this, from ordering supplies, clinical, submitting insurance for not only for office visits, but hospital consults and surgeries. And I also worked for an ambulance company. It was a private ambulance company, so it not only did medical transportation, but it also did emergency care that we went over. And that was in all aspects. There's obviously the importance of medical necessity and doing your claims accurately. And then, of course, there is the last part, which is what we're pretty much going to focus on today, is the patient side, what's left of the co-insurance, co-patient, and how to recover your money. That's enough about me. But we're going to go right into the cash flow and the importance of being proactive. If your practice, and I'm reading this flat out, if your practice is doing billing, follow-up, and collections the same way it did 5 years ago, you need to strongly consider making some changes. And you've probably changed quite a bit in the last 5 years. And the last thing, and you've kind of been affected, I would think, from just about everybody else, but the last thing you may have changed was how proactive you are in preventing going into that collection side. And we all know collections really starts with you. It has a little bit of a negative connotation, the word collections, but we know that that's exactly what you need your practice to be doing, is collecting money. Here's today's agenda. In the next 30 and 40 minutes, you will be informed. Hopefully you'll pick up, we all want everyone to pick up at least one key thing that they can bring back immediately and apply to their practice. And we're going to talk about the 8 keys for practice cash flow optimization. The crucial importance of a practice cash flow. Again, it starts right from the beginning, probably even before they're walking in the door, to what you want to do to get it. It's all about day sales outstanding and improving that for your cash flow and trying to get as much as humanly possible right up front. Collecting money is harder than ever. You've had a lot of changes hitting you in the last 5 years, and it's kind of time for this last part of it to be on the patient side to get everything you can. And you truly do need every single penny. You keep getting pay cuts. Understanding what you're up against. And that is you're going to need to relook at everything. I do want to stress here, working with partners such as MD Everywhere and having them help you to know what you're up against is also really key to improving your cash flow. Learning to identify the 4 payer types. I think this is a little unique to Transworld, but it's something that's really, truly common sense. And we're going to be talking about this a lot further in a moment. Improving your internal collection practices. That will include written standing operating procedures. And again, proactive measures. Understanding your biggest cash flow threats. Working profitably with a collection agency. We know that's the tail end, but we all need to partner and have something for the people that aren't paying you on a timely manner. And actually working on considering new cash flow solutions and partnering with experts to help you do that. Okay, the first thing we mentioned, and we're going to have a poll question at the end, is the crucial importance of cash flow to your practice. and improving, getting paid right from the beginning, knowing what you're supposed to be paid, and having your entire team and staff and partners helping you do that. AR is one of the biggest financial assets of most practices. You need to get paid for the work you're doing, and you need to know what you're going to be paid. Your cash flow is the best indicator of your overall practice efficiency. When you improve your cash flow and you spend less time chasing past due accounts, you literally help the entire economy as well as your practice, and get things working very efficiently for you. And you can practice cash flow can be influenced in many different ways. There's lots of ways you can do your improvement, literally starting from the beginning to how you're asking for the money, or you shouldn't even be asking for it. It should be almost natural that you get your money at the time of service, whenever possible, and knowing what that money's what you're supposed to be collecting for your staff to be ultimately very efficient. There will always be some surprises that you're unaware of that may not have happened, that you maybe they didn't have a checkbook or something, but it's getting between 80 and 90%, if at all possible, right up front. And I'm going to turn this over to Allison. She has a poll question for you.
Great, thanks, Mary. So I'm going to launch our next poll. And the question is, when was the last time you did an audit of your cash flow? And your options are 0 to 3 months, 4 to 6 months, 7 to 12 months, or over 12 months ago. And I'll give you a few seconds to submit your response. We have about 51% of folks reporting right now, so a few more seconds. All right, great. I'm going to close it, and I'll share the results with the attendees. So it looks like that 52% of attendees have done an audit on their cash flow in the last 3 months, which is great. 17% are falling into that 4 to 6 month bucket, 7% into 7 to 12 bucket, and 24% have not done a cash flow audit in over a year. I'll turn it back to you, Mary. What do you think of those results?
I'd like to say I'm surprised, but I do know, actually really coming from medical, that we're always putting out fires and we don't always get to put the attention on cash flow that we may need to do. So it's a little bit of a wake-up call for the people that haven't done it recently to make sure that they're doing those audits.
How frequently do you recommend that folks do a cash flow audit?
It should be live right on there. They should be working with a partner, or their medical they should know where it is all the time. As the office manager, it should at least be reviewed weekly or monthly. If you, we talk about the importance of cash flow. I think most people get this. They'll submit their insurance claim daily, but they'll only send someone a bill once every 30 days. So there's something, kind of a little bit of a disconnect there. So you do need to review it weekly, if not daily.
Okay, great. Thank you.
The second key we want to talk about is collecting money is harder than ever. I'm going to sound like I'm saying this a lot, but being proactive and going after the money sooner, you're going to see how important that is. 1 in 3 people, here's a fact that I'm sure most of us may not have been aware of. 1 in 3 people have an account in collections. The average consumer has 12 creditors. You might be one of those 12. You don't want to be the number 12. You want to kind of move your bill to the top of the pile. FICO, that's the credit reporting. They have just de-emphasized medical debt on credit scores. This just happened in 2014. Just to give you a little bit of a background about that, it is, I guess if you're a consumer and we're in a good thing, as working in medical, and quite frankly, no one knows what it's like to work in medical unless you've done it, it's not so positive. You can report the credit. What it basically means is it no longer negatively affects their score. So it'll be easier for people to buy a home or to make purchases, but it won't help you anymore. And I'm kind of sorry to say that, but it is. This is true. So you can. I know anything actually can be Googled, but you may want to look up some articles on FICO and medical debt. And they have de-emphasized, as I said, it no longer affects credit, or the consumer's credit score, or very little. The average U.S. adult has $5,200 in delinquent accounts. That's a lot. And the national recovery rate for medical practice is only 14.6%, and most of that, quite frankly, is because you wait. You wait until the debt becomes unrecoverable because we're not handling it. We don't have systems in place to try to recover it young. And then we're going to talk about improving that. That is something you want to avoid. Again, you don't want to be reactive. That would be reactive, where you're going directly into maybe a year-old, into contingency collections, or simply writing it off. Okay, now we want to understand what you're up against. You are literally up against, we just talked about some of the money that's out there, and you want to make sure that your bill gets paid. So your commercial businesses, they have a variety of aggressive tactics to get paid. And you're up against them. You can see the doctor down on the poor pennies, and the consumers and the mortgages, they're right on top with the big money. Their collection practices are not scrutinized the way healthcare practices are. You have much more compliance concerns, as do we, quite frankly, as a third party, but you have much more concerns than the consumer businesses do. And you're trying to really, most of the time, you're trying to collect from the same people. So you need to get some policies in place to even that pile up a little bit. You need a progressive, proactive approach. What you were doing before, again, simply in the past, do not work. There is ways to improve it. You can, due to technology, the follow-up systems have dramatically improved, and you want to make sure that you have those policies in place and you are partnering with people that and businesses that can help you. And you're simply not using all the resources available to help manage your cash flow. And good advice, quite frankly, I don't think it's that hard to find. You're on this call today. It might be hard to find, but you have MD Everywhere is right on the line with you. They will literally help you not only get paid sooner, but get paid much more efficiently, and to recognize what you need to do to improve it. And at the tail end, when it goes into the patient side, past the 90 days, what you need to do about it, feel free to contact us. And you need to be prepared to compete. Again, we totally understand how sometimes this became unimportant. It is of vital importance for you to put healthcare at the top of your list. But you're also running a business. And on the business side, collecting the money for the services that you provide is of utmost importance. You can't work for free, and you need to have policies in place to even it out a lot. Early identification and intervention are crucial. Knowing when to start using third-party services to help recover is truly crucial, and we can help you with that. And you're probably already, hopefully, going to be looking into this, but you really do need to leverage the newest tools in technology with techniques to help you compete, to get paid faster and more efficiently for those collectible dollars. And then, quite frankly, you need to know what is not collectible. We're going to talk about that in a second, so that you're not chasing money that you may never get. Alrighty. This is probably common sense, except you may not have literally identified it before. So learning to identify the 4 payer types. So again, you know, we work in the dutiful people that walk out literally with their checkbook and credit card in hand when they're walking through your front desk. Your front desk knows they've got right in front of them what they're supposed to be recovering, and they're getting that, you know, the $50 copay or whatever, you know, right up front, and the person's all prepared to ask for it. Front desk almost doesn't even have to say anything. It's just, here you go. Your visit today is $75. Then you have people that you did bill, and they're distracted. You're going to have to remind them a few times. That's where you're probably what you're doing now. Maybe statements and phone calls, and you're going to get paid. They just, you know, we talked about some of the other bills that they're up against. They must be a little distracted, and you will get paid simply by asking for the money. And that's typically about 80% of your cash flow. Again, you want to audit that and see where you are. These last 2, disrespectful and deliberate. Disrespectful has ignored you. They've ignored, we call first party. They've ignored your first party contacts. And the only way to get them to pay is with some third party intervention. So using some tools to do that is important. It's similar to kind of like human nature. If they've ignored you 5 times, they're going to keep ignoring you. But if you give someone a new reason to pay that bill, or a new fact, it's going to put it on top of the pile, and they're going to get paid. And they're disrespectful. Again, you want them back in the practice. We all recognize how important it is to maintain our patients. And also, we really do want them back. We don't want to lose anyone. But unfortunately, we don't always know. I'm going to go to this last one. And this is deliberate. Who is deliberately going to not pay you? They were probably deliberately not going to pay you right from the initial encounter. But you don't know that. And the sooner that you know who that is, the younger, I really should say, the younger you know who that is, and you probably have to go through all these steps to identify them, but they're the last bit, maybe 5–10% of the people of your accounts receivable is deliberately not paying you. And they're not going to pay you 2 years from now. You can send a statement every 30 days. You're still not going to get paid. They're truly professional collectors, and you need to know who they are so that you can take appropriate action and make those decisions that you need to make, whether that is using contingency collections, hiring, depending on the dollar amount, maybe, you know, legal action, or writing it off now that you've done your, you know, obviously we know in medical there's a lot more, again, you're not against the commercial side, a lot more importance in due diligence with the regulations that you have. And I'd like to turn this over again to Allison for our poll question.
Great, thanks, Mary. So, you know, in line with what we were just talking about, our question is, what percentage of your patients would you classify as deliberate? So, you know, best guess, 0%, up to 5%, 6 to 10%, 11 to 20%, or over 20% fall into that deliberate category. We have about 50% of folks responding, so I'll give it a few more seconds. Okay, great. So let me close this and share the results. And we can see that up to 5% of your patient base falls into that deliberate category, which I think is in line with what Mary was talking about in terms of percentages. And then we had 31% falling into that 6 to 10%, 16% in 11 to 20, and 9% in over 20%. Mary, what do you think about these results?
I think exactly what you said. I think what people think it is may be different than reality. So we're going to go. You may want to go back to, although a lot of you have kind of tested it. Is well, it's a good thing. If you know when, you know who is deliberate, you can take appropriate action. So I think if you know right away, that's good. And for the people that don't know, we want to start taking some proactive policies to find out who's not paying you and what you can do about it.
So Mary, you've mentioned a couple of times that you need to identify these deliberate folks earlier on. So what signs should a practice look for that's going to indicate that their patient is going to fall into this payer type? And what's the solution there?
It is, you probably won't get concerned until you're at like a 60 or 90-day time period. And then most people are a little concerned, and quite frankly, you should be very concerned. They've ignored all those attempts, and that's kind of where it's falling in the last two buckets, disrespectful and deliberate. Putting in a policy to do some third-party intervention early, or something coming from a collection agency, collecting another, I don't know, 30 to 50% of those past dues, and then whoever did not pay, now you know. Now you know. Whether, hopefully that'll be, as young as 4 to 6 months. Who do you need to take stronger action with?
Okay, great. Thank you.
You're welcome. And they put themselves in there, by the way. We always feel a little guilty over taking stronger actions, but you've done everything. I'm sure everybody on this webinar wants to do everything they can to work with their patients. So if it gets to that point, that they've literally put themselves into that situation, not you. Alrighty, thanks, Alex. Oops. Okay, so what can we do? And Allison just asked, what can we do to make them pay? The dutiful in the practices truly is mostly right at the window, right? Or quite frankly, you send that initial statement, you got their EOB, you send a statement, you had some money that you didn't expect, and they turn around literally and the check comes right back in the mail. The Distracted is a reminder series. What you're doing right now with your letters, and hopefully you're even using a third party to help you with this also, but you have policies in place for your follow-up, and it can be done more frequently than I think you may have thought of in the past. Then you have disrespectful, which is third-party impact. I'm just going to mention a little bit with Transworld, or most of our clients that work with Transworld, they're typically using us after the 90-day when it's most recoverable, and all the recovered money goes back to the practice, but they are getting third-party impact. And then just literally draw a line in the sand right there between disrespectful and deliberate. Whoever is left, it's kind of identified for you. There's no guesswork anymore. Those are deliberate people. They need professional collections for their literally professional debtors. And we've done everything else. They've ignored everything else, so you take appropriate action. And the fifth key is improving internal collection practices. What you can do and don't do, that you can take away right now. You want to have a fixed written credit policy. It's going to cover your broken appointments, interest charge, acceptable payment terms, or there should be no guesswork. This should really be in writing for your desk. It is a team. You probably want to separate the clinical from the accounting side also. There's times where, maybe, patients asking the doctor, how am I paying? So that third-party impact works right in your practice. You can defer it to your office manager or to the person at the front desk who will review that with them. So it's always a good idea to try to separate that out. Don't put aging. This sounds a little strange. This is something we may have done all along. So we're going to look right at this and then kind of see what you think. You don't want to put aging at the bottom of statements like this. What you're actually saying is, okay, looks like you're getting this, and hey, they don't really expect to get paid. I'm going to wait till it goes into the last bucket, and then maybe there's no urgency there, right? And it's all about urgency and taking preventative measures to get paid with your accounts receivable. The same as take preventative measures with your health. So don't encourage people to pay you not on time. Healthcare typically is net now, not net 30. So we want to keep that in mind all the time, that we expect to be paid immediately. And you also don't have an enclosed amount. You don't want people to encourage people to pay less than what is due, totally due. They may do it anyway, but let's not kind of remind them that on a $2,000 bill they only have to pay $50. It's what they owe is what they owe, and as you know, right after the explanation of benefits come through, it's quite clear what is due. How to talk to patients. This is, right at the window, or maybe during phone calls. I know we have a lot of hospital consults that are a little bit hard in getting that, harder sometimes getting the correct information and doing the billing. But basically, be very comfortable asking for payments. It should be no different than somebody walking into the store and buying a loaf of bread. They should just feel comfortable paying, and your staff should be comfortable letting them know how much is due right then. It should not be how much can you pay. They should be paying, you just ask for the $100. And if there's a past due amount from a prior visit, please make sure that that's taken care of today. And you always want to get a commitment if your staff does need to bill someone for reasons. You need to get a commitment, a date commitment on when they're going to be paying the balance. And then collection myths. Active collections can scare patients away from a practice. It should really, quite frankly, it is the exact opposite. People respect businesses who respect themselves, and our value is also by the money that we're paid. So no one should feel ever uncomfortable. I think you've realized that sometimes the patients that are the most difficult are the ones that haven't paid the bills. If they pay the bill, they have it's just exact opposite. The longer it is from the date of service, the more reasons people justify in their minds not paying, and they probably won't come back anyway. So getting your money sooner actually maintains your patients. It is allowable to add collection agency charges to patient balances. That is total myth. It's absolutely not true. You might want to talk to your accountant or your lawyer. There are some things that you could do, maybe depending on the state that you're in, but you kind of want to get away from that. You want to. There is judgments and court rulings on the exact opposite, and you do not want to put your practice at risk. So you want to be very careful there. And the cost of collections is a percentage of what the agency charges. Again, that's simply not true. The cost of collections it's $8, according to MGMA, $8 per follow-up. That's a lot. So that's your cost of collections. It's a preventing going to a collection agency. That, your internal collections is still collecting money. And here we go. Paid. We want to make everything, your balance is paid sooner and improve the time you're paid to your net now. Depreciation is one of the biggest threats to your practice's cash flow. I worked in medical for well over a decade, and before that I was in regular accounting, and I've done ran accounts receivable departments and collections, I always knew, and I'm sure you did too, that your accounts become harder to collect the older they got, and you just got less out of it. What I did not know is, according to the U.S. Department of Commerce, they did a study showing the depreciation, the flat-out depreciation on your accounts. It's 0.5% a day, starting at 60 days, or 15% a month. That is crucial to your being proactive and preventative. If you can find no other reason to do everything you can to get your patient bucket under control, if we want to call it that, versus the insurance bucket, this is it. If you look at your accounts receivable and see that you're over your 120 days, and if you can run an aging report that you should be looking at quite frequently, by the way, if you're running that aging report and there's some over a year old, oh man, 10% recoverable. And these are just not something we want to talk about, not something you want to think about, but it's something that is a reality. These are actual facts. So early intervention, again, we're going to go back to that, knowing who those deliberate people are that aren't paying you. Again, writing it off or taking some other action is absolutely crucial. Identifying it and handling it at a younger age than you may have thought was acceptable in the past. Again, I've done it for over a decade. I did not realize. But if we're looking at that 365 days, you put 90% of the work in there, it's probably literally cost you more than some of the bills. So all you got good at was sending out statements and not getting paid. They've already made the decision not to pay you. At a year, if you'd have known that at 6 months old, how much better would your practice's cash flow be? That you knew that person wasn't going to pay you at a younger age. Okay, number 7. Well, here we go. We do know that there are going to be people that are not going to pay you on time. You want to do everything you can. You're going to partner with someone similar to MD Everywhere. We've mentioned we do partner with them. We are interfaced with them, so we could flow right over to Transworld. But objectively, you want to look for a collection agency. It's always going to happen. So what do you look for? What are you going to check for? You want to make sure that you're not being skimmed. The average debt that goes to collections is $1,500. Medical practices, I have from some $25. I don't think that's as much as it used to be, but $25 to maybe $200 or $300. So if your bill is skimmed, it's probably not being worked as well as you want. Overcharging. Most of the money that's recovered, I don't think most people realize this, I know I did not when I was working in medical, was that collection agencies actually get paid 88% of what they're paid, they've done without a single phone call on the contingency side. So paying a percentage for a written notice for third-party impact may not make good sense. So make sure you're not paying full contingency for letter collections. Throwing good money after bad. Be wary of attorneys and agencies that have add-on fees for skip tracing, court costs, attorney fees, credit checks. So getting a low percentage and then find out that you have an extra cost later may be something at the very least you'd want to know about before you sign on with your collection agency. And compliance. Again, done this for a long time, did not realize this till I Transworld's licensed in all 50 states. I thought all collection agencies were. Turns out that most are only licensed in 1 or 2 states where they're located. So if their debtor moves into a different state, they can't recover it. They're not licensed to recover there. New York Metro and the Northeast is, well, the whole country now. Very transient. So even if the person was local when you provided the services for them, they may not be local anymore. So you want to make sure that you're partnering with a collection agency, and they should be your partner. They're part of running your business, and there should be a trust partnership there, but that they are licensed in every state, and the compliance is as important to them as it is to you. On the other side of it, what to look for in the collection agency. Tiered pricing, making sure you have the tools you need a la carte that works. You want to make sure it works for your practice. Again, we're talking about the different types of payers. You do not want to treat someone who's not a deliberate, maybe a little more disrespectful, that just needed that third-party impact. You may not want to treat them to, go right to professional collections with them, which is one of the reasons we avoid it. We did not know that there was a choice, a better tool to kind of help you maintain your patients. Diplomatic approach. Find an agency that gives you diplomacy. You're in medical. It's not the same as commercial. You do want someone who knows the difference. So look for an agency that is diplomatic in their treatment of your patients. Just because they owe the money may not. You still want them treated well and strong. Robust reporting. You need to know what the recovery rate is, what your net collections are, your total assignments, everything right there. Right in the next part, right online. We're going to talk a little bit about the compliance, but if you're using a collection agency that requires you to fax paperwork or provide copies, it's 2015. It is time to say goodbye for that. You need secure online portals. Even more importantly, if you can have that identified to you and you can put it right on the software that you're already using, that would be literally a home run. So you need that security. And is the collection agency specializing in healthcare? Do they understand what's proven approach that works for your patients versus somebody buying widgets and didn't pay for it? I believe that's you'd want someone who's much more diplomatic. Allison, I'm going to turn it back over to you. I see we have a little poll circle.
Yes, we do. So our next polling question, we wanted to know from the audience, are you currently working with a collection agency? So real easy, yes, no, or don't know. We'll give it a few seconds for people to answer the question. About 70% have reported, so a few more seconds. All right, great. So I'm going to close it and let me share the results with the audience. So 69% are working with a collection agency, which is great, and 28% say they are not working with one right now.
Wow. Wow, Allison, 28% is not, and you may be rethinking what you're doing with your collection agencies, and literally, are they providing you reports? Do you know what they're doing? So take a look at how you're being helped. Again, it may be time to make a change. There's a little infographic right here. You have, of the money that's submitted to the agency, only 25 to 50% are actively worked. Wow, right? We mentioned in healthcare it's about 14% is getting collected. So it's net back in collections out of every $1,000, you're getting $94.90. We don't even want to look at that. Okay, so we talked about the 28% of you don't have a collection agency. What are you going to look for? How could so here's some questions to ask them to make sure that anyone of the people that are using the collection agency, see if they can pass this test. And only if you can. Are they a healthcare collection specialist? Pretty simple, you would think, but if they're doing commercial debt, they're doing big dollars. How are they helping people that have businesses that are small dollars? Do you have diplomatic and intensive services? Again, key in medical. You want to at least start out diplomatic and kind of grow with intensity once it's ignored, but you want to make sure that they have different approaches for that you require. Are they offering a fixed fee service option? We mentioned that 88%. You don't want to pay contingency fees for the written notice that goes out first. So they're offering a fixed fee on the written side before it goes into deliberate collections. Do they have an online collections interface? Is it built right into your software? Are they utilizing the technology to do that? There are over 100. I'm just talking about Transworld right now, but we have over 100 vendors that we're working with, including MD Everywhere. That it's built right into the software. There's just no learning curve and extremely efficient. Are they offering first-party services for their clients? If first party is in your name. Are they fully compliant with FDCPA, TCPA, and HIPAA? I don't have to talk about HIPAA, and you know that better than anyone, but FDCPA is a federal law. The Fair Debt Collection Practices Act. They also need to be compliant in all 50 states and all the local regulations, including the boroughs, for example, in Manhattan. And TCPA is Telephone Collections Practices Act. Specifically, there's quite a few in there. Our current president wrote this law when he was senator, so it's not going away. And again, you can Google these, but basically that is kind of the cell phones. You can't have technology or auto dialing into cell phones. And there's a lot more to it than that. But they need to understand it, and are they compliant with federal and state and local regulations? And are they recommended by healthcare industry experts, MGMA, AMA, your local? Are they recommending your collection agency? And finally, you're going to be open to progressive cash flow solutions, utilizing, presenting right up front from the time of the appointment, and utilizing revenue recycle management, such as MD Everywhere, is very key to this. But then after it goes into the patient side, what are your early out strategies? We had talked about it being $8 per follow-up. You don't want to keep throwing good money into bad as it starts aging out in you at 120, 150 days. So what in writing, what are your strategies? Do you have a multi-step accounts receivable approach? Right from right at the window to, again, you have a unique role with the insurance and explanation of benefits and what you can bill your patients. So you do need a multi-step approach. You also have a unique role, many of you, in that you're doing, I did surgical billing versus transport to the hospital consults, and how your staff handles it throughout. First-party services, getting your 30, 60, 90-day statements done. Fixed fee collections, again, generally speaking, that's a collection agency who provides you third-party impact, but the recovered money, all of it, is sent back to the patients. And then whoever did not pay, you now know, is deliberately, then you can put them into contingency or maybe go to court. Insurance claim prompting, again, revenue cycle management and insurance, and knowing sooner when what you need to bill your patients. An automated collections interface right from your software to your collections, having everything right in one place. And then finally, patient portal technologies. That's kind of self-explanatory. So we really want to make sure that you have everything and that you're open to different ideas, being proactive and progressive and preventative in your cash flow as you are in your healthcare. And I think we're running a little low on time, but you have the Healthcare Creditors Bill of Rights. You should be expected to be paid on time. Extending credit, your terms are zero now, or right now, right? Extending credit is a courtesy. It should not cause you financial or regulatory risk. You should be able to focus on your specialty and not have to worry about the complying for collections. Unpaid bills really do negatively impact everyone. You just can't run your practice efficiently if you don't have the money you earn to do it. And late paying patients should be held accountable. But that should be done in a dignified, lawful, and respectful manner. We should all be held accountable. So quickly, to review what we talked about today is how important is your cash flow, improving your day sales outstanding. We discussed why collecting money is harder than ever. We describe unique challenges to medical collections, your $60 bill versus commercial debt, the 4 types of payers, and you want those delivered to no sooner. We discuss how to improve your internal collections. Your biggest cash flow threat is you want to do your audits to make sure, but it's probably become more and more the patient bucket, and we really need to be looking at that also. Working profitably and talking to your collection agencies who are a partner with you, and talk to your experts. And there's some new cash flow solutions. Now, Alice, I'm going to turn it back to you for any questions.